Hi, everyone. Welcome to the Long Island Hub's presentation specific to the fiscal impact of the New York Health Act on counties, municipalities, and school district with a specific emphasis on Long Island. First, I want to introduce myself. My name is Melanie Dorigo. I'm the Executive Director for the Campaign for New York Health. I'm here tonight with our Long Island Hub leads, Dr. Cheryl Cashin, Dr. Judith Esterquest, and Mona Morris. We're also really excited tonight to have this event co-sponsored by the Long Island Network for Change, the Long Island Progressive Coalition, PEER, Show Up Long Island, Suffolk Progressives, Indivisible Long Island, and Healthcare for Long Island, which is a joint venture between the Poor People's Campaign as well as the Long Island Democratic Socialists of America. So we want to welcome you and thank you. I do want to let my friend Joe Sackman, who's the Executive Director for the Long Island Progressive Coalition, just say a quick hello. Joe, you're muted at the moment. I don't know if you want to say hello and welcome your folks.
Hey everybody, Joe Sackman here. Thanks, Melanie. I think what we've got tonight are some great updates about the New York Health Act, things that people don't really think about when we talk about single-payer healthcare, which is property taxes. Just to give a little quick preview. So I'm really excited about this. I think it's a game changer, and thanks for everybody who's joined us. And I'll hand it back to you, Mel.
Thanks so much, Joe. Is anyone else here from those organizations that wants to say a quick hello? I know I see members, but I don't know if there are any organizational leads. No. All right. Well, again, we're really thrilled to be here tonight to bring you this important information. We really believe this new white paper that we'll talk about very shortly is a game changer, not only for Long Island, but across the state. But certainly for Long Island in particular, as Joe mentioned, so many Long Islanders, regardless of your political affiliation, are concerned about property taxes, right? Most of us want to make sure that our property taxes are going to invest in our communities, right? And that they're not being wasted, that they're being used wisely.
So, Melanie,
yes.
I don't see the screen share. Are other people seeing it?
Okay, hold on one second. Give me one second.
Sorry, folks, but this is a good deck, so we want you to see it.
Yes, we do, for sure. How's that? Can you see it now?
Yes.
Perfect. All right. So with that, we will jump right into the presentation tonight. First, we are going to talk about a little bit about our healthcare crisis. Then we're going to talk a little bit about the New York Health Act. We want to make sure you know what this important piece of legislation is. Then we're going to talk about the current healthcare impact on counties, municipalities, and school districts. Then we will talk about how the New York Health Act could change that, right? We want to make sure that you all leave tonight with your questions answered and really understanding the New York Health Act from various angles. We'll finish up by highlighting what the New York Health Act could mean for your property taxes, as well as your own individual healthcare and community health. And then we'll close it out with some Q&As. We're very fortunate tonight. We'll be presenting a new white paper that was just released in May. You're very fortunate in Long Island because the authors of the white paper are two of our Long Island Health, are two of our hub leads for our Campaign for New York Health Long Island Hub. They are both with us tonight. So you've got a real special treat in being able to ask questions directly to our authors. Okay, so let's dive in. First, I want to take a look at where New Yorkers stand right now. Frankly, New York's healthcare system is in crisis. A little over 740,000 New Yorkers currently carry medical debt. Nearly half of adults have faced cost barriers to care. About 1 million New Yorkers are currently uninsured. A third are underinsured, meaning they have some type of insurance, but it's still too expensive for them to get care. And too many New Yorkers are simply skipping care because they just can't afford it, right? And that is sort of status quo healthcare in New York. But unfortunately, it is getting worse. I'm sure you're acutely aware of the federal healthcare cuts that were passed in the OBBA last July. These cuts threaten hospital closures. They threaten to double the uninsured population within New York. They will also result in skyrocketing premiums for folks who even have private insurance. But unfortunately, the crisis doesn't just stop there. This new white paper, this new analysis that I mentioned earlier, will show you, and we're about to talk about that tonight. It'll show you that the rising healthcare costs are also draining our communities, driving up our taxes, straining our local budgets, and forcing cuts to schools and services. Healthcare just simply is too expensive, and too much of what we pay is siphoned off by insurance companies while coverage continues to erode. But that's a pretty grim picture. But if you know me, you know that I always try to find the silver lining. And the silver lining we will find right now. And that is the New York Health Act, right? The New York Health Act is an active piece of legislation in the New York State Legislature that would bring single payer universal health care to the state of New York. It would cover all medical, dental, vision, hearing, prescriptions, and long-term care, making it the most comprehensive health benefits package in the entire country. It's funded in a very straightforward way. The bill is written in a way that would eliminate administrative waste. It would also allow New York State to negotiate drug prices, saving our health system billions of dollars that could be reinvested directly into care instead of going to insurance companies. Those savings, combined with a progressive tax that replaces premiums, copays, and deductibles, fully funds the system while lowering costs for over 92% of New Yorkers. And I want to be clear that over 92% is conservative. There are studies that show, over 96% of New Yorkers as well. Okay, so let's talk a little bit about the hidden problem, right? Most people think healthcare only affects them when they go to the doctor. We think about the cost of our own monthly premiums, our deductibles, our copays, our coinsurance, prescription costs, our out-of-network care, right? But there is also a hidden tax that most of us don't even realize we are paying, or as we will learn tonight, overpaying. And that hidden tax is the rising cost of public employee insurance, the erosion of public employee benefits, and the losses to our communities because of it. Now, I want to be very, very clear. Our public workers absolutely deserve top-notch healthcare, but so do you, right? We don't always think about the many ways in which healthcare affects our entire community and really the many aspects of our lives, but we really should. Right. And so let me give you an example. The cost of healthcare, has a huge impact on our schools and our local governments. So when the cost of health insurance rises, as it does every single year, that hits our local government and our school district budgets. These budgets have to be balanced. So when costs go up, say 12% each year, which unfortunately in the last year we found over and over that's pretty standard. What happens? What happens when these costs go up? Well, either property taxes go up or services get cut, or public workers, including teachers, get laid off, infrastructure projects get delayed, and, frankly, our quality of life goes down. So New Yorkers aren't just getting squeezed by our own rising premiums, copays, and deductibles. We're getting squeezed at all angles. Because insurance costs go up every single year, we're overpaying for public employee health care through our local budgets, even as their benefits continue to erode. And across New York, that's exactly what's happening. Healthcare costs are crowding out everything else. So let's take a look here. This is present day New York. And, frankly, this is only a sampling I'm going to take you through, right? Now, this is a sampling of the entire state. But you can see Rockville Center, right, which of course is in Nassau County, Long Island. They had to lay off 22 teachers this year to try to balance their budget. There are other schools on Long Island that had to lay off teachers as well. There was some state intervention to help them, not have to completely decimate their staff. But these problems are happening in our backyard as well as around the state, right? So just a quick snapshot, Yonkers School District, not too far away, they have a $101 million budget gap. The Buffalo mayor proposed raising property taxes by almost 26% that will continue to climb over the next 3 years for an increase of 45%. Syracuse schools are facing major budget gaps, proposing teacher layoffs. Fulton School cutting 54 staff positions. Cortland School District will eliminate 50 positions and raise taxes by 6.5%. And you can see it goes on and on and on. West Babylon is considering closing an elementary school, and that is simply because local governments and school districts must balance their budgets. And so when these healthcare costs get driven up each and every year, as they do, someone has to pay that bill, right? And unfortunately, we pay that bill, whether we pay it through an increase of property taxes or we pay it by, larger classroom sizes, et cetera, et cetera. It is decreasing our quality of life and our quality of living. And all of that is due to this bloat from insurance companies, right? Really raising those prices every year to get paid. However, there is some good news, right? And that's what we're here to talk about tonight. Which is this new white paper that I mentioned earlier by health economist Dr. Cheryl Cashin and Dr. Judith B. Esterquest, who analyzed the fiscal impact of the New York Health Act on counties, municipalities, and school districts. Their findings show that the New York Health Act could save local governments and school districts, get ready for this, billions of dollars across the state. Billions of dollars. But before we dig into the results of Dr. Cashin and Dr. Esterquest's white paper, I want to take a closer look at how local budgets actually work. I think for those of you who may not be as familiar with budgets, it's really important to have a foundation so that you can really absorb the impact of the results that Dr. Cashin and Dr. Esterquest found. So when we think about a budget, I want you just for a moment, picture what do you think about, right? I think for many people, we hear the word budget and we sort of tune out, right? Our eyes glaze over and it can feel like a bunch of jumbled numbers on a page. But tonight, I want you to think about a budget in a different way, right? What if we saw a budget for what I believe it truly is, right? Not just numbers, but a true blueprint for our priorities and a powerful tool to shape our communities, right? Martin Luther King famously said, a budget is not just a collection of numbers, but a reflection of society's values, priorities, and how it treats its most vulnerable members, right? And so at its core, that's what a budget is. A budget is simply a plan. It reflects what we choose and value to invest in. And that's really important. And I want you to really hold on to that as we go through this presentation tonight, right? Because when we take a closer look at these budgets, we see that these numbers aren't just a mess of numbers. They're not abstract actually at all, right? What they are is a blueprint that determines the strength of our schools, the quality of our healthcare, and the cost of living in our communities. So stick with me. Yes, we're going to look at some numbers, but more importantly, we're going to see how our tax dollars can work better for all of us. So let's begin by taking a look at what goes into a budget. Right now, remember, a county budget, right, which is what we're about to look at, it's simply a plan, right? A plan for how the county spends money each year. County budgets pay for things like public safety, social services, roads and infrastructure, some public health, employee salaries and benefits. And a budget answers two main questions. Where does the money come from and where does the money go? right? So let's take a look at this county budget here. Where do they get the money from? Well, counties get money from several different areas. They get some money from sales tax and revenue. They get some state and federal aid, some from fees and fines, some from miscellaneous revenue. But the largest local source and the one that impacts us most directly is property taxes. And again, budgets at the local level and state level, as well as school district level, must be balanced, right? So when costs go up, as I mentioned earlier, that revenue does not go up. So counties often have to figure out how to balance that budget, and that is often done through property tax increases, cutting services, or laying off workers. And so something to point out that, I want to make sure everybody understands is that within every single budget, there are both variable costs as well as fixed costs. Now, healthcare costs are fixed and they are intractable, right? So these are costs that go up every single year, which means local governments and school districts must make really difficult choices. They have to figure out, do we cut positions? Do we cut programs? Do we raise taxes? Do we do all three? It puts school districts in very precarious positions that, frankly, they do not want to be in. Now I want to take a look back at those hidden taxes we talked about earlier, right? So remember, we talked about that we don't just pay for individual or family health care, right? Through our property taxes, we're also paying for the health care of public employees who absolutely provide important services for our communities. But we also pay into what is called the Medicaid county share. This partly funds our Medicaid program and ensures that our most vulnerable have access to health care. So I want you to think about this if you're hearing that for the first time. Not a lot of folks really know the ins and outs of this, but if you're hearing about this for the first time, a really easy way to think about it is, we're paying into essentially two buckets, right? There's one bucket that represents the cost of health insurance for those public employees, and another bucket that represents what we term the Medicaid county share. Every single county is responsible currently under New York state law to pay into their Medicaid county share so that it helps to fund our Medicaid program at the state level. So the first bucket, right, the one that funds health insurance of public employees, that one gets more expensive every single year. And it does so because it's it's subject to private health insurance administration, which of course, as you've heard me say tonight several times, always increases, right? That second bucket, the county Medicaid share, this is a really important expense because it helps fund, services like long-term care for our seniors and people with disabilities, as well as hospitals in underserved communities. But here's where it gets really, really interesting, right? Under the New York Health Act, the Medicaid county share would no longer need to be covered by counties because the cost would be absorbed by the New York Health Plan. And because the New York Health Act brings down the cost of healthcare overall, the cost of health insurance for public employees costs less. And as you'll soon see, in many cases, a lot less. So when your county government no longer has to shoulder these massive healthcare costs, both because, the insurance companies are charging more and more, and because, they're shouldering the county Medicaid share, it creates tremendous opportunity for our communities, right? Opportunity for property tax relief, opportunity for those funds to be reinvested back into community needs. And this means, potentially more savings for taxpayers and or more resources for our communities. So we're not talking about small change, right? We're talking about potential county savings and property tax reduction that is significant. So now I'd like to dig into the paper, the white paper by Dr. Cashin and Dr. Esterquest a bit more now. But firstly, I just want you to understand the methodology that they used. So first and foremost, they calculated what the savings for municipal governments and school districts could look like under the New York Health Act. They used a methodology that was first employed by Albany's treasurer, Darius Schahanifer, a number of years ago. They used a simple calculation of net savings based on current health insurance costs in the local budgets, and then they subtracted the estimated payroll tax obligation under the New York Health Act. They used actual numbers, actual budget numbers. They did not use modeling or assumptions. And they were able to replicate this methodology on a large scale using publicly available budgets and salary information. Something important to note is that these estimates are conservative and savings are likely to be higher when the cost of procuring and administering health plans are also removed from local budgets. All right, so what were the results? Hold on to your hats, folks. So after sampling counties in all 10 economic regions of New York, their analysis found that counties would spend 90 to 95% less on healthcare than they do now under the New York Health Act. And this would be an annual savings. For municipalities, they found that under the New York Health Act, municipalities would spend 80 to 85% less than they currently do under the New York Health Act. And again, that would be an annual savings. And for school districts, they also found that school districts would spend 80 to 85% less on healthcare than they do now under the New York Health Act, also annually. So what does this look like, right? Let's take some examples. I know we're sitting here as Long Islanders probably saying, what, right? We know that if we know something that Long Island is famous for, right, I'd say maybe the beaches, maybe the Hamptons, and high property taxes, right? So let's take a look at what this could look like in Suffolk County, right? And, I think Dr. Cashin and Dr. Esterquest, when they first embarked on this work, they started with Suffolk County, right? In large part because Suffolk pays the highest property taxes in the state of New York, right? So let's look at this. Let's take a moment and let this sink in for a second. The tall bar on the left represents what Suffolk County paid in healthcare costs for employees and retirees in 2025. The blue bar next to it, you see that teeny tiny blue bar there? That is what Suffolk County would have paid under the New York Health Act. The analysis found that Suffolk County could save $745 million annually if the New York Health Act was implemented today. That's an astonishing number. The authors then wanted to take a look at what these savings could mean for an individual who lives, let's say, in the town of Islip in the Brentwood School District within Suffolk County. Their analysis found that the town of Islip could save $17 million annually, and Brentwood School District could save a whopping $83 million annually. And for those of you who may not know, Brentwood is it's a fairly large school district serving about 18,000 students. I want you to think for a moment what an $83 million savings could do for a economically vulnerable population like that consists of the students in Brentwood today. I mean, we're talking about just life-changing investment into schools that have been disinvested in and largely ignored for many, many years. So, the next thing that the authors did, they wanted to understand, right, that well, what would the savings look like for a person who lived in the town of Islip, maybe have children in the Brentwood School District within Suffolk County? They added up all those savings and found that each person, who lives in Islip in the Brentwood School District in Suffolk County, what would they save? Each person could save $1,437. Now, keep in mind that is a per person savings, not a household savings. So if you have 5 people in your house, multiply that number by 5. These are real savings for Long Islanders who are very much struggling at the moment. These savings are enormous, both in percentage as well as absolute dollar terms. And you'll see, if you look to the right of the chart, you'll see that, under the New York Health Act, Suffolk County would reduce their healthcare spend by 92%. The town of Islip would reduce their healthcare spend by 87%. The Brentwood School District would reduce their healthcare spend by 84%. These are massive changes that would have a huge, huge impact across Long Island and frankly throughout the state. So I do want to also point out the Nassau County savings for our Nassau residents in the house. What our authors found is that there would be a 90% reduction in healthcare spend in Nassau County. Nassau County could save $610 million annually. But something that I find quite striking as someone who believes so deeply that every person deserves high quality comprehensive health care. It astonishes me that these types of results hold true throughout the entire state. Our authors, as I mentioned, they sampled counties, municipalities, and school districts in all 10 economic regions. And these results were replicated over and over and over again. And this was regardless of size, income, rural, suburban, urban population. Of course, the absolute size of the savings from a dollar perspective does vary, but proportionately they were the same. We are leaving millions of dollars, billions of dollars on a state level on the table when that money could be reinvested back into us and our communities. So let's just take a quick look at what some of those additional savings look like. If you take a look at the blue bars, the blue numbers are total savings, and the red dots signify the percent of the budget. So you can see how much, what percent of the budget is being wasted on overpayment for healthcare through this hidden tax. So let's take a look. As I mentioned, Suffolk County, massive savings, Nassau County, massive savings. Our friends just to the north of us, Westchester County, massive savings. 20% of their budget could be saved. That's wild. But even if you look toward, some of our much smaller counties, they're still saving millions and millions of dollars and all fall within range. I want to just, quickly point out New York City. If you recall a couple of months back when New York State was trying to balance and pass its budget, there was a big to-do with Mayor Mamdani saying that if the state did not help out New York City, then he would have to raise property taxes on New York City residents. Take a look at that number. With the New York Health Act, New York City could save $13.6 billion, a whopping 12% of their budget. Imagine what that money could do, for New York City residents, for services, for students. These are huge, huge numbers. Here's another chart that just really sort of is another proof of concept, but we're looking here at municipalities. So if we look at the town of Hempstead, they could save over $138 million, over 25% of their budget. The town of Brookhaven could save, close to $50 million. That's 13% of their budget. Let's see who else here. Glen Cove, right, could save 15.3% of their budget. Town of North Hempstead could save close to 9%, over $8 million. Excuse me, yes, over $8 million. Rockville Center, over almost $7 million, 12% of their budget. Shelter Island, which is a very tiny little municipality all the way out on the East End, they could save about 14%, a little over 14% of their total budget. These would be huge, huge opportunities for municipalities, for counties, and we'll soon see school districts to really plan for the future, right? For once, New York State, by passing this legislation, could give them a lifeline, right, to actually invest in their communities rather than being in the unfortunate and precarious position to having to cut, which unfortunately seems to be the norm. But let's take a look at those school districts for a moment. We talked about Brentwood School District a moment ago, saving, $83.4 million. That's 12% of their budget. Hempstead School District would save over $33 million. That's almost 12% of their budget. Great Neck School District would save over $27 million. Port Washington would save over $25 million. Uniondale would save a little under $25 million. Rockville Center would save over $14 million. Manhasset would save almost $14 million. Glen Cove would save over $13 million, et cetera, et cetera, et cetera. And again, I really want to underscore that these are annual savings. These are not, one and dones. This is money that would be saved and realized every single year. And school districts, counties, municipalities would be able to determine how best to reinvest that money. Now, before we move on, I do want to underscore a couple of points. Because I'm sure you're sitting there saying to yourself, how can this be? These savings are extraordinary. And you're right, they are extraordinary. But there are three main drivers for why these savings are so significant. The first is that under the New York Health Act, as we talked about earlier, is that the Medicaid county share is absorbed into the New York Health Pool. So for counties, that brings down the cost significantly. The second is that local governments, and school districts are currently paying for all employees as well as active retirees. And with New York Health, retirees are no longer paid for by employers, right? So that really shrinks the cost for many of our local governments and our school districts. And the third is that these salaries for local governments, whether the county or municipal level, as well as school districts, are generally middle-class salaries, right? We don't typically see anybody in those positions. I don't think we see it at all, making millions and millions of dollars, right? Or even close to $1 million. We don't see that. And so any employer that predominantly has a workforce with middle-class salaries is going to see major savings under the New York Health Act. Because if you remember back to the beginning of the presentation, we talked about it being fairly funded, and instead of having a regressive tax, the New York Health Act has a progressive tax, right? So middle-class salaries, it's going to bring down that cost significantly. So what does all of this mean? Hopefully I've done my job and this is not a surprise to you. But what this means is that the New York Health Act would drastically reduce healthcare spending at our county, municipal, and school district level, allowing for more investments in our communities and or lower property taxes. And it also means better healthcare for you and your family, right? Every New Yorker, every single New York resident, public employees, etc., would have the same exact high quality healthcare. So that means the most comprehensive coverage out of any other health benefits package in the entire country, as we talked about, all medical, dental, vision, hearing, prescription drugs, and long-term care would be provided to every single New Yorker. There would be no more premiums, copays, or deductibles, no more restrictive networks, and no more denied claims. So you're getting better healthcare, the best healthcare in the country, and more investment in your community and potentially lower property taxes. So to sort of finish out here, for years, we have thought that the New York Health Act was a healthcare bill, right? And of course, it is a healthcare bill, that, as I mentioned, would provide upgraded and comprehensive care to every New Yorker. But it's also something else, right? And that's what this analysis brought to light. The New York Health Act is much, much more than a healthcare bill. It's also an affordability bill. It's a property tax savings bill. It's a reinvestment in our communities. And it is an absolute lifeline for struggling local governments and school districts. And because the New York Health Act decreases healthcare costs overall, there are several opportunities to save money and improve the lives of New Yorkers. And, we think that that is something that everybody can get behind. So with that, we are happy to take your questions. We'd love to hear from you. We hope that this has been a informative presentation tonight. So with that, I'm going to go ahead and stop sharing, and I'm going to invite Dr. Cashin and Dr. Esther Quest to join me for questions.